Hi guys, it is X. Welcome back to my channel. Thank you guys so much for watching. On today's video, we are going to be talking about how to pick an NP specialty and what I wish I knew before I applied to NP school. And so before you swipe me away and click me out of this video, please like, comment, and don't forget to hit the subscribe button and share if you can. Thank you. Okay, whether you're a nursing student or a nurse already or debating on going to NP school in the future, here are things that I just wish I knew before I applied to NP school and how I chose my NP specialty. So I originally in 2014 when I went into nursing school was like, I'm gonna be a nurse practitioner because it's like being a doctor without being a doctor, and thought I don't know why that's like what my perception of being an NP was. And then I got into clinical and I absolutely love bedside. I kind of saw more what doctors did at the bedside and I just didn't really care to be in an NP role. Because I was like, I love bedside. I love getting to spend more than 5 minutes. Sorry, my cat is freaking attacking my cord. With a patient. And so it wasn't until I worked with residents who just convinced me, like, go back to school, you know, you are smart enough, like you can do this. And I totally felt so motivated, and that is what brought me to be down into the NP route. I thought I was done. Like after my bachelor's, I was like, no more school. And then we ended up here. So here I am. I have almost a year and like 2 months left of NP school, but I kind of got misled and I kind of wish I would have done a little bit more research myself. I thought I was doing the right things by just asking around, asking nurse practitioners themselves what specialty I should pick. So here I'm going to go through a little bit of the dilemmas that I faced back in 2018 when I was first looking into it, thinking about it and stuff like that. So basically I worked at a teaching hospital. I was in a trauma ICU and I worked with 3 nurse practitioners who were actually working, and then one of my coworkers happened to be a nurse practitioner. So when I was thinking about, you know, diving in, and I was a brand new ICU nurse. I think I only had a couple months under my belt. I was still training, but it was starting to be something that like I really wanted to do, especially now in ICU, getting to see the intubations, bedside procedures, like chest tube insertions. Like this is just like something I was so excited for and was like, I want to do this. Like I'm watching them do it and I know I can do it. This is something I really want. So 2 of the nurse practitioners that I worked with were specifically adult gerontology acute care NPs. One of them that worked there was an FNP, and then my coworker was an FNP. I asked each and every single one of them their opinion, what they thought, like what route I should do. I have always had a passion and love for ICU once I became a nurse. When I was a nursing student, I kind of didn't know what I wanted to do. I kind of wanted to do psych and ER and ICU, and then finally just found my passion and loved ICU. So I had asked 3 of them, the 3 males that I worked with, what NP specialty do you have? Why did you choose it? And what do you think I should do? The 2 acute care NPs told me, I'm acute care NP, but I wish I would have done FNP because FNP you have a variety of places to work. Okay, makes sense. I talked to my coworker who is an FNP and he told me the same thing. He chose FNP because you can work with all ages and basically anywhere. And then I asked the female NP that I worked with who was an FNP, what do you think I should do and what did you choose? And she told me that she chose FNP because there was a more variety of places that she could work. Her options were not limited. However, she wishes she would have done acute care because she did not learn how to intubate and place central lines in school. Perfect. Like that, thank you. That is all I needed to know. So I thought. So I ran with this, decided I was going to do FNP, was like, why would I limit myself to a specialty and choose a specialty specifically in adult geri acute care when I can just do FNP, learn every single age, not have limitations, get hired in the ICU, and then just, that's it. Work, learn from on the job. Well, reality hit, and it hit really big in my 4th class into FNP school when I realized that is not true. You cannot be an FNP and work in the ICU legally. It is out of your scope of practice. Now, where does this discrepancy come from? So I didn't learn this until my 4th class when we read this law book, and I'm going to place the law book picture right here so you can read it for yourself, or if you decide to buy the book to understand. This book is great because it tells you all the laws in every single state, how to write your name as an NP in each state, because in each state you actually are not called advanced practice nurse practitioners, or you're just a certified NP. Like, it just tells you what each state, what this kind of scope of practice is, what your credentialing name is, and then what you can and can't do in each specialty. And that book opened my eyes to realize what my scope of practice was actually in the route that I was in. Okay, so the book is by Carolyn Rupert, and it is called Nurse Practitioners, Business Practices, and Legal Guide, I believe. I will have to look at the book again, but it opened my eyes to see what the definition of what age group you actually can see per practitioner and what is appropriate for your scope of practice. So when I read this book, I freaked out. I was like, wait a minute, my passion is ICU. I want to intubate, I want to place lines, like chest tubes if possible. Like, F&P route might not be the right route for me. Like, here I thought I was making a smart business decision by not picking a specialty that was gonna limit my scope of practice and I would just be able to learn things on the job. Like, that is what I thought. But here's where kind of the discrepancy and issue comes in, and why you're actually seeing FNPs in the ICU and stuff like that. So years ago, when nurses were demanding like higher education, please, like, let's make a BSN, let's make an MSN. This cat. No. Sorry. FNP was the original, like, only nurse practitioner advanced practice license that you could get at the time. I'm sorry, I don't know the history. I don't remember the history. I've read it before, but I don't remember the history, so I don't know exactly what years this came out. But anyway, this was the only licensing that you could get at the time. So they were allowed to work in multiple... Kabuki! Sorry. You were allowed to work in multiple places in the hospital, outpatient, and stuff like that. Come here. Come here. I'm sorry. It's very distracting. She just wants my attention. So you were able to work in multiple places throughout the hospital because that was the only licensure that there was at the time. But so hospitals were hiring FNPs in ICUs, in ORs, and like stuff like that. So now that more schools have come out, more licensures and more different like specialties have come out, now legally states are starting to crack down on what you can actually do, what your scope of practice is. So that is no longer like possibility. Like, you can't, it is out of your scope of practice legally. Like, if there is a patient that decides to sue the hospital, it's not the hospital's fault that you're out of your scope of practice. It actually lies on you. You can be liable if that family decides to sue. So reading this stuff scared the crap out of me, and I was like literally debating, like, what do I do? Do I stay in F&P? Like, I was thinking at the time, like, I want to be a mom. I like the schedule. I'd rather have a 9 to 5. Like, I'd rather work in an office where I do have time for my child. Like, what do I pick? But at the same time, I'm fighting myself because I love the ICU. I love what I do. That is my passion. That is where I feel the happiest. So I was like, I don't know what to do. I was freaking out. I was asking all these people. I was calling my school for advice, my counselor, like my family, my friends. Like, I literally lost sleep over this. Like, I did not understand. Like, I am making huge life decisions. And in my current program, it was actually cheaper to do adult gerontology, acute care. It was actually shorter time frame to do adult gerontology, acute care. So I finally, like, I talked to my fiance, and what hit me, what was the driving decision for me, was the fact that my school is one of the schools that actually has you do a lot more hours than every other school. There are schools that only require like 500 hours of clinical. My school requires 720. So I sat there and I thought to myself, okay, I don't know too much about primary, so please, if you're a FNP or primary care, like, if you obviously this isn't what you do all day, but this is how I kind of generalized it in my head. Do I want to do 720 hours in a doctor's office in a primary care setting doing assessments for 722 hours? I mean, I'm sure you do more than that. Obviously, there's like pap smears and all this stuff that you do. However, I thought to myself, do I see myself coming home, being excited to tell my fiance what I did in clinical today, doing that? Or am I going to be excited doing 720 hours and coming home and telling my fiance that I intubated today, that I placed a central line, that I placed a dialysis catheter? And that is what was the final it for me. That was the decision that I was like, that is it. I'm switching. I don't care. I'm comfortable. Even if it limits me into working only in a urgent care or ER or ICU setting, like, that is fine. If it's not the schedule I want, that is fine. But I would rather be happy knowing that I'm doing something that I'm passionate about. Another question I asked myself was, if I truly loved primary care, if this was something I really wanted to do, I would be doing it currently, and I don't. I did, when I first applied to FNP school, want to do primary care for these specific reasons, and that is because I started off on a step-down unit, and I saw so many patients that told me, I never see a doctor. I am very healthy. I can't believe this happened to me. There are people out there who don't ever go see doctors. They don't know the importance. They don't get physicals and yearly exams and stuff like that, and then they end up in the hospital. And they have these horrible outcomes, these horrible situations, these horrible diagnoses that sometimes for some people is way too late. And that is because they didn't take preventative precautions, and those are the stories that break my heart. So originally when I went into FNP, that was my mindset. My mindset was, I want to help people like that. I want to push education and primary and preventative services out and educate the public on these things, because it's really sad to me when I see a patient who tells me, I am very healthy, I don't see a doctor, I never get sick, and all of a sudden you have a terminal cancer diagnosis. Like, why? Like, you know what I mean? Like, those are the things that I really wanted to do originally in FNP. But then I realized, like, I love the ICU. I love watching people get their life back. I love watching them progress. I love being there when they are near death and attempting to do everything I can in my power to save them and bring them, basically back to life, help them get their life back. And that was just the deciding factor for me. Another thing I wanted to talk about was, please ask your hospital, your state and local practices, do research into that, because one thing that I find so confusing, which I gave up even trying anymore, was working in the ER. So one thing that made it confusing was, can FNPs work in the ER? Can acute care, adult gerontology. Jesus, I hate the name. I wish they would have found something else. I think acute care NP would have been better, but now it's adult gerontology acute care NP. Can they work in the ER? And here is where the questions arose for me and confused me, and I find just strange, was when it came to being able to follow these people and find them as preceptors for my school. So, they said that FNPs can't work acute care. It's out of the scope of practice. However, you can work in the fast track, because the fast track is usually like the coughs, the colds, the lower acuity portion in the ER. However, you have to be able to see patients of all ages. When you're an adult gerontology acute care nurse practitioner, you cannot see patients under the age of 13. It's 13 and above, at least in the state of California it is. My school does a very good job, even though they're in Texas, of making sure that I know my laws in California, and they give me all the research for it. So if you are an adult gerontology acute care NP and you want to work in the ER, you can't work fast track because you don't see kids under this. I mean, there are people out there who do it, but legally, you're supposed to see 13 and up. So when I was seeking a preceptor, I was very excited because I was like, yeah, of course ER is something that I would love to experience, because I feel like that is where you get a lot of your critical thinking skills, because this is on presentation. You don't really know what's going on, so you have to figure it out. I've always wanted to be a detective, and that's what I love about this part of my job, is like, that's my job, to figure things out, figure out what is going on with these patients, kind of like detective work. However, they told me I can follow somebody in the ER as long as it's not fast track. And I'm like, why? Like, it's just so confusing. So if you want to be an NP and you want to specialize in the ER, there is specific programs that you can take in order to decide, in order to be an ER NP. However, if you're like FNP route with hopes to go to the ER, do your research and make sure that you're not just going to be stuck in fast track. And if you're an adult gerontology who wants to do ER, make sure that that ER knows that you can't see patients under 13 years old. It's out of your scope practice. So this whole thing is just like, I'd rather just stay in the ICU where I'm safe, and not have to deal with this legal stuff. That is my passion. That is my dream. That is my goal. So that is just where I'm going to stay, and I'll just stay my butt out of the ER. And then another thing that I kind of wanted to brush up on was postmaster certificate. So when I was in F&P and program before I switched over to acute care, I thought about it. I called the school. We talked about it. They're like, you can always, okay, so it was going to take me, I think, 2.5 to 3 years to get my FNP, and it was going to take about 2 to 2.5 years to get the acute care. And it was, I want to say $4,000 cheaper to go this route. So I was like, felt a little bit better when I heard about postmaster certificates. So I was like, oh, okay, hold on. I can stick to FNP. I can go ahead and just finish my program, graduate, and then come back and get a postmaster certificate in acute care. However, I thought about it and I was like, why am I gonna go be dual certified? I mean, it would be amazing to be dual certified, but why am I gonna go and be dual certified if this isn't, and like pay for 2 certifications that are like about $500 each if I'm not going to actually work in one of them? Like, it just didn't make sense to me after that. Why am I gonna spend another $10,000 for schooling, another year of my life, another, certification, another board that I have to study for? Like, what would be the point? So I decided against it, but I'm glad that postmaster certificates do exist, because going back to the beginning of this vlog and conversation that we were having, I follow a couple of nurse practitioner groups on Facebook, one for students, one for just nurse practitioners in general, and then one specifically for acute care. I have seen so many people, and I go to school with a couple of people who currently are FNPs, do work in a hospital, and they are like in the ICU or in the ER, and they are now forced to go back to school and get postmaster certificates. And it just kind of breaks my heart for these people, because they're probably already smart enough, they probably already know what to do, they're probably skilled enough and have worked in these positions for over 10 years, and now, because laws are changing, they have to go back and get, X amount of certification in higher education just so they can keep their current job. So that is what I want to prevent you, and why I wanted to make this video. I don't want you to do what I did and just pick FNP because you thought you can work anywhere. Not true. I don't want you to have excitement of picking a specialty, realizing at the end it's not what you wanted, and then have to go spend money either recertifying or going back and having to do research on what your actual scope of practice is. And my biggest thing is I want you to make sure your patients are safe and not practice out of your scope of practice, because that would just, I would hate to have a lawsuit on my hand. Like, it's just one thing I don't ever want to have to step inside of a courtroom. So I hope you guys found this video informational. I hope it helps you decide. And I mean, there's many NP specialties out there. I just, in order to decide if you're between two, because I see people who ask, like, I kind of want to do acute care, I kind of want to do CRNA, kind of do want to FNP, kind of do want to do acute care. Follow your heart. Like, what do you see yourself doing? Because I see people asking themselves questions like this all the time on these nurse practitioner forums, like, hey, I'm kind of stuck in between two routes, like, I don't know what to do, I don't know what to pick. And honestly, just save yourself the anxiety and stress that I put myself in through when I was like thinking I was smart and just gonna go FNP route and have all these options. Like, follow your heart, do what you love. Like, if you don't want to do anesthesia, but you're doing it for the money because they make the most amount of money, then you're in it for the wrong reasons. And you want to be happy with your career. Like, nobody wants a nurse, a doctor, a nurse practitioner, a CNA, any type of healthcare employee to take care of them when they're like burnt out in their job, when they seem like they don't care for you. Like, I want you to stay as happy and as passionate in your current situation for as long as possible, so that you feel, your patients can tell that you love your job. That is my little rant. It is over. Thank you guys for watching. Good luck in picking your specialty. Like I said, always follow your heart, and have a good day. Bye. Sorry, I already cleaned up, but there is something that I wanted to add to this video that I totally forgot to talk about. And that is that do NP school when you feel like you're ready to do NP school. And the reason why I'm saying that is because as soon as I was done with my BSN, I took a year off and then decided to go back to school. I wanted to get it out of the way because I was approaching 30 years old, and I wanted to make sure that I had school out of the way before I decided to have kids, because I was like, I don't know how I'm going to do this and go back to school if I end up having kids. So, now that I was in school and they made us kind of research the certifying bodies of the AANC and the American Association of Nurse Practitioners, like, they made us look at what the tests were, what they required, and what the renewal requirements were. And there was something on there that kind of struck me that I was like, oh crap, like, maybe I should have waited to go to NP school. And this is what it was. I went to NP school as soon as I could because I wanted to get it out of the way, like I said, to have kids. However, my plan was never to go and be an NP as soon as I graduated. My plan was to be in bedside as long as I can, have kids, and then later on, become an NP. I didn't realize that in order to recertify, you actually have to have 1,000 hours, depending on the certifying body, in order to renew your license. So now I'm like, does that mean I should, immediately apply to NPs, immediately apply for jobs, find one if I can in this pandemic, and start working, because I have to meet those 1,000 hours of certification and stuff like that in order to renew my license. So that is just something that I want you to think about. Don't do what I did and just be like, let's get it out the way now because I don't want to go to school later. Like, go when you are ready. Bye.